Dear students, welcome back. In this session, we are going to discuss about sciatic nerve part 2. We have already discussed about the sciatic nerve, its root value, and also the nerve supply in the back of the thigh. Okay. Yes, we are going to discuss the remaining part of the sciatic nerve. Okay, before starting the remaining part of the sciatic nerve, we are going to discuss the previous one. That is, the sciatic nerve is the thickest nerve of the body. It is the terminal branch of the lumbosacral plexus, as it is having two parts. One is the tibial part and the common peroneal part. For these two things, the root values are L4, L5, S1, S2 and S3. The tibial part root value is the ventral division of ventral rami of L4, L5, S1, S2, S3 segments of the spinal cord, whereas the common peroneal part is having the root value L4, L5, S1, S2 segments of the spinal cord. If you see the course, the sciatic nerve arises in the pelvis, leaves the pelvis by passing through the greater sciatic notch below the piriformis muscle, okay, to enter into the gluteal region. So in the gluteal region, it doesn't give any branches in the gluteal region, and in the back of the thigh, it lies deep to long head of biceps femoris and superficial to adductor magnus, and in the back of the thigh, it is getting terminated by giving two terminal branches in the back of the thigh. Okay. And if you see the branches in the back of the thigh, it gives branches to the hamstring muscles and also the adductor magnus, hamstring part of adductor magnus. Okay. And the terminal branches are the tibial nerve and the common peroneal nerve. Okay, now we will see the tibial nerve. So this tibial nerve begins as the larger subdivision of the sciatic nerve in the back of the thigh. It has a long course first in the popliteal fossa. Okay, popliteal fossa, and then in the back of the leg. Okay, in the popliteal fossa, it descends vertically from upper angle to the lower angle, and at this part it is present superficial to the popliteal vessels. Okay, and in the back of the thigh, the nerve descends as the neurovascular bundle with the posterior tibial vessels. It lies superficial to the tibialis posterior and deep to the flexor digitorum longus. And finally, it passes through deep to the flexor retinaculum of the ankle. And this tibial nerve finally terminates by dividing into medial plantar nerves and lateral plantar nerves. If you see the branches of this tibial nerve, so in the popliteal fossa, it gives some muscular branches, that is medial head to the gastrocnemius and lateral head of the gastrocnemius, and also the plantaris muscle, soleus and popliteus muscle. So these are the branches given at the level of popliteal fossa. If you see the back of the leg, it gives branches to the soleus again, and flexor digitorum longus and flexor hallucis longus and tibialis posterior muscles. So that means it supplies almost all the muscles which are present on the back of the leg, both superficial muscles as well as the deep muscles. Okay. If you see the cutaneous branches at the popliteal fossa, it gives as sural nerve. Okay. And the articular branches are it gives some articular branches to the knee joint. These are given in the upper part of the fossa. Those are called as superior medial genicular arteries, middle genicular arteries, and inferior medial genicular arteries. Okay. And this at the back of the leg, it also gives medial calcaneal branches. Medial calcaneal branches, that is cutaneous branches, and also branch to the posterior tibial artery. Okay, so these are the branches given by the tibial nerve. Okay, if you see the plantar nerves, that is medial plantar nerve and lateral plantar nerve. The medial plantar nerve supplies to abductor hallucis muscle, flexor digitorum brevis and flexor hallucis brevis. And if you see the cutaneous, it supplies this medial 3.5 toes as well as the nail beds. Okay, the lateral plantar nerve supplies abductor digiti minimi, flexor accessorius, interossei, lumbricals, adductor hallucis and flexor digiti minimi brevis. That means these plantar nerves supplies to all layers of the sole, and it supplies lateral 1.5 finger. So these are all the branches which are arising from the tibial nerve. Okay, and so this is about the tibial nerve. And the another terminal branch of the sciatic nerve is the common peroneal nerve. This common peroneal nerve is further divided into superficial as well as, here you can see, superficial peroneal nerve and deep peroneal nerve. Okay, so the superficial peroneal nerve supplies to the peroneal group of muscles, that is peroneus longus and peroneus brevis, whereas the deep peroneal nerve supplies to the anterior compartment of the leg, that is extensor digitorum longus, extensor hallucis longus, peroneus tertius. Okay, this deep peroneal nerve gives some cutaneous branches, that is lateral cutaneous nerve of cough, and also it gives lateral terminal branch of the deep peroneal nerve, ends by forming the dorsal digital nerves of the adjacent sides of the big toe and the second toe. Big toe and the second toe. Articular branches or the branches to the ankle joint, tarsal joints, tarso-metatarsal joints, and metatarsophalangeal joints of the big toe. Okay, if you see this superficial peroneal nerve, here we can find the superficial peroneal nerve. The superficial peroneal nerve having some cutaneous branches to most of the dorsum of the foot, including the digital branches to medial side of the big toe, to the medial side of the big toe, and also the adjacent sides of second and third and fourth and fifth. Okay, these are all the cutaneous supply by the superficial peroneal nerve. So for the superficial peroneal nerve, this one is the superficial peroneal nerve, mainly supplies the peroneus group, and most of the dorsum of the foot, cutaneous branches are supplied by the superficial peroneal nerve. Deep peroneal nerve supplies the anterior compartment of the leg and medial 1.5 fingers. Okay, of cutaneous supply we can see. and also it supplies some articular branches to all the joints from ankle joint, tarsal joints, tarsometatarsal joints and metatarsophalangeal joints of the big toe. So these are all about the sciatic nerve part 2. Thank you.